Okay, now we are going to the non-epithelial one. If it's non-epithelial, it means it's not epithelial origin, so it might be from the lymph. So it may be malignant lymphoma from the lymph node, or it's from metastatic tumor. So it means from, for example, from the breast or from the prostate cancer. So it's something which is metastasized from other organs. Okay. So these are the signs of benign. So this is benign. Usually it's mobile, except it's on the if it's on the palate, of course, because palate has very rigid skin or mucosa. If unattached to skin, no ulceration, slow growth, long duration, no pain, no numbness, and no facial palsy. So these are the very common signs of benign types of salivary gland neoplasm. Okay, so we'll go for pleomorphic adenoma. So you have to know pleomorphic adenoma well. It's the most common types of benign salivary gland. Okay, and also if we compare benign and malignant, pleomorphic adenoma is still the most common types of the neoplasm. Okay, 70% will happen in parotid gland. Others will be in submandibular and minor salivary gland tumor. Okay, usually it's around 40 to 60 years old, and female is more common compared to male. Okay, so this is pleomorphic adenoma. Can you see? So this is the most important point that you have to bring back home. If you want to know if it's pleomorphic adenoma or not, okay, you will say there are actually mixture of everything. Okay, I'm going to explain to you later. Okay, so just like I told you before, because it's benign, it will be slow growing, painless. Okay, if it's in parotid, 90% will be at the superficial lobe, and it's usually at the tail. Okay, and then if it's minor salivary gland, usually it's at the lateral palate, and also it will present as submucosal mass. Okay, so this is at the parotid, at the tail of the parotid. Okay, this is at the palate. Can you see it's actually from the lateral, but because it's too big, it's going to cross the midline. Okay, so this is here, there's submucosal mass. If you see intraorally. Okay, so you can see, so usually if you want to see neoplasm of the salivary gland, you have to look from the front and also from the back and from the bottom of the patient. Okay. So you can see this is very massive one. Okay, so histologically usually it's encapsulated. It means there's capsule around it. Okay, it will be mixture of epithelial, myoepithelial, and stroma components. So that's why we call it pleomorphic adenoma. Basically, it's just mixture. It's just like your ABC. It just campur all the kacang and syrup and everything together. Okay, so the stroma part is the most striking one. Okay, stroma means it's not the cell, the background of it. So the most common one is the chondroid. Okay, so and then the cells, the epithelial cells usually can be arranged in nest, sheets, ducts, trabecular. It means the pattern of the cells arrangement. And then the cells contain normal cytoplasm. Mitosis are rare because you have to remember, okay, if it's malignant, usually there will be high mitosis and the cytoplasm will become lesser compared to the nucleus. The stroma will be myxoid or fibroid or osseous, but the most common one just now is chondroid. And usually it's hypocellular. It means the stroma is more striking compared to the cellular. Okay, so can you see? Okay, can you see the color of it, the different colors of it? And can you see there's not so many cells except for this one? Okay, so can you see? So this is the chondroid one. Okay, so the color, and you can see the stroma. The stroma is basically the background of it. It's not the cells. The cells will be limited, but the background of it, there will be plenty of colors, just like this. Okay, some myxoid or chondroid, osseous. Okay, so it's a lot of variants of the stroma. Okay, so here is in the higher power, then you can see the cells. Okay, this is the epithelial cells in sheets. And then can you see, this is the stroma, the pink one. Okay. So this is another one, types of pleomorphic adenoma. These are the cells, but this is the stroma. It doesn't look good, this one, but this is better. You can see the cells here. There are plenty of cells in sheets and some form like ducts. Okay, and then you can see the stroma, basically the background. It's the combination of some pink, some purple. Okay, so that's why we call it as pleomorphic adenoma, because it's just mixture of everything. So this is another one. Okay, the cells is over here, but it's not plenty. Okay, so the gross pathology, if you take the mass out and then the gross pathology, what you are going to see, usually it will be smooth, well demarcated because it's encapsulated. It will be solid because it's some sorts of neoplasm. It might have a little bit of cystic changes. You can see the stroma a little bit myxoid. Myxoid is pinkish in color. But when it's gross pathology, you cannot see it's pink and it is encapsulated. Okay, so treatment, usually it will be complete surgical excision. Okay, but you have to preserve the facial nerve. And then you have to avoid enucleation and tumor spill. It means that the tumor will remain there. And then in long term, if we don't remove the pleomorphic adenoma, it can turn into squamous cell carcinoma. So we call it as squamous cell carcinoma X pleomorphic adenoma. So it X. So just like your ex-girlfriend or ex-boyfriend. So this X pleomorphic adenoma. Okay, so we've done with pleomorphic adenoma. You have to remember, pleomorphic adenoma, for you to easy to remember, it means pleo is the mixture of everything. It's the most common one. And then the mixture will be, the stroma will be a lot of color, and then the cells will be usually scarce, or there will be plenty of types of pattern of the cells. Okay, so that's the pleomorphic adenoma. So we go to monomorphic adenoma. It means it's just the one type. So the first one is Warthin's tumor. It's capillary cystadenoma lymphomatosum. You see, it's so complicated, the name. So it's 6 to 10% of parotid neoplasm. Usually it happens in older Caucasian males. So Warthin's tumor is quite unique because usually it's in male and it's usually occur bilaterally, and it associate closely with smokers. So you have to ask the patient if the patients are smokers. Usually it's in parotid gland, and then neoplasm usually just one side unilateral, but in Warthin's tumor it's bilateral. Okay, it may contain some sorts of brown fluid if we do the fine needle aspiration. Okay, so this is the Warthin's tumor. So you see, you don't know is it pleomorphic adenoma or Warthin's tumor. So you have to know the difference clinically. For example, if the patient is smoking or not, is it bilateral or not? Okay, so this is in parotid gland. Usually, if it's pleomorphic adenoma, it will be more common in the tail of the parotid gland. Okay, so that's why you have to know, you have to have basic knowledge, stronger basic knowledge of the clinical manifestation of salivary gland. So the gross finding, it will be encapsulated just like pleomorphic adenoma, smooth, and there will be a little bit of cystic spaces. Okay, and the solid area, you can see white nodules. Okay, this is the different one compared to pleomorphic adenoma, because with Warthin's tumor, it has lymphoid follicles. Okay, remember, it's originally they say it's because of the lymphoid. Okay, so you can see lymphoid follicles. Okay, so they say it may arise from salivary gland, but with the inclusion of the lymph node. So that's why you have the lymphoid follicle, which is white in color in gross pathology. So it must have two types of component. First is the epithelial and the lymphoid component. Okay, so the epithelial component. So this is the very important histological features of Wharton's tumor. The epithelial component will have 2 layers of oncocytic epithelial cells. Okay, so the epithelial cells that I'm going to show you later, it will be 2 layers. Okay, which is one is the luminal and one is the basal. I'm going to show you later. The cytoplasm will stain deep pink. Okay, and then the lymphoid component, there will be lots and lots and lots of lymphoid. It means lots and lots of lymphocytes. Do you know what is lymphocyte? Lymphocyte is usually a cell with very round and dark nucleus. That's the lymphocytes. Okay, and then there will be germinal centers. Germinal centers is there's plenty of big cells in the center. So for you to say it's Wharton's tumor, you need to have both lymphoid and oncocytic epithelial elements. So you need to have both lymphoid and epithelial components. Okay, so can you see this is in lower power? Okay, you can see it's very dark. There are so many, plenty, abundance of cells here. This is the germinal center. Okay, so these are the lymphocytes, and then this is the epithelial with 2 layers. Can you see this is the first layer? Look at my arrow. Okay, so this is the first layer. Okay, this is the luminal epithelial and this is the basal epithelial. Okay, so this is in lower power. So in lower power, you already have the clue that it's Wharton's tumor, because look at the epithelial component. It has 2 layers, and in the lymphoid component, you can see plenty, abundance, and very dense lymphocytes there with germinal center. Okay, so this is a very, very lower power. You can see it's encapsulated. Can you see it's just like fibrous there, here, covering it? So that's the capsule. Okay, so this is the a little bit higher power, 10 times magnification. You can see the epithelial. Okay, the epithelial, this is the color of the epithelial. It's a little bit lighter, and then you can see actually there's 2 layers, 1 and 2, 1 and 2, and then inside it there will be plenty and very dark nucleus and very dense cells. Okay, so this is a very high power to show you the epithelial. So this is the luminal epithelium, which is palisading. Palisading means it's like stretching, and this is the basal one. Usually it's like flat. Okay, so this is 2 layers of epithelial. First layer is the basal, and then this is the luminal epithelial. And then in the mass, there will be plenty of lymphocytes. There are the lymphocytes. Can you see? It's very dark, round cells there. Okay, so this is the histology, just to remind you back. Okay, so first layer, second layer, very dark cells there. First layer, which is the luminal. Luminal means the epithelial which facing the lumen. Okay, and then the basal one which facing the mass. Okay, so these are very dense lymphocytes there. Okay, some sorts of germinal center maybe here, but you can see there are 2 layers. That's the most striking part of Wharton's tumor. So you have to remember 2 things. Okay, it has epithelial and also the lymphoid components. For epithelial, it will have 2 layers. One is the luminal, which is palisading. It means like it's elongated, and the basal layer, which is a little bit flat, and the lymphoid, it will be very dense. It means a lot and lot and lot of lymphocytes with germinal centers at certain area. For example, this one. Okay, so that's the Wharton's tumor. So this is another 2 layers. This is the lumen. This is the luminal epithelial. This is a basal cell, and then can you see these are the very dense lymphocyte. This is the germinal centers. Okay, so I've already told you and I've already explained to you the histology. Okay, so just to remind you and train your eyes. So the lumen, the epithelial should be the palisading luminal epithelial here, basal epithelial, and very dense lymphocytes with germinal center, parts of germinal centers. Okay, so this is a very higher power. It's very obvious, the double layer and the lymphocytes. Okay, so That's the Wharton's tumor. You have to bring back. It's usually associated with smokers, male. Usually it's bilateral. It's in the parotid compared to the pleomorphic adenoma. It's not in the tail. So you have, histologically, the most important thing is it has two components, the epithelial and lymphoid components. And with epithelial, it will be bilayer. And then with the lymphoid, there will be a lot and lots of lymphocytes with the presence of germinal center. After this, we are going for malignant